Hello, I am Dr. Ramakrishnan. I am a surgical oncologist from Chennai. My area of interest is in gastrointestinal cancers, especially luminal cancers like cancers of the stomach and the colorectal. So the incidence of gastric cancer in India compared to many other areas in the world is not very high. Around 4 of every 1 lakh population in India have a chance of getting gastric cancer. India is not even among the top 25 nations with the highest incidence of gastric cancers. However, because of the large population of more than 1 billion people that we have, in terms of the absolute number of cancers that we see in India, we are probably the 3rd highest among any country in the world.
Okay.
The reason for gastric cancers in India are many. Like what happens in the rest of the world, a particular bacterial infection called the Helicobacter pylori contributes to a large proportion for the development of gastric cancer, not just in India but across the world. But fortunately, the rates of this bacterial infection are coming down with better endoscopic diagnosis and methods to identify and treat these infections. In the past decade, we are seeing a decreasing incidence of gastric cancer in India. So if you see India, there is a huge variation across different parts of the country in the incidence of gastric cancers. The highest incidence of gastric cancers in India are in the northeastern part of the country, especially Mizoram, Nagaland, Arunachal Pradesh. They have a very high incidence of gastric cancer, which matches one of the highest incidence of gastric cancers anywhere in the world. But at the same time, if you look at other parts of the country, like the western part, the incidence is very low. So there is almost a 10 to 11 times variation in the incidence of gastric cancers across the country. Now, the reason why the northeastern states have a very high incidence of gastric cancer again are multifactorial. It may probably have something to do with the kind of diet that they consume, high salt diet, the smoked, the consumption of smoked meat. This could also contribute a lot to the higher incidence of gastric cancer in that part of our country. Gastric cancer is predominantly treated with surgery, but surgery alone is not enough to cure a patient with gastric cancer. Chemotherapy also plays a role in curing gastric cancers. At the moment, I would say India is not behind the rest of the world in terms of the availability of treatment for gastric cancer. Surgery is the most important aspect, and the quality of surgery that is being offered in many high volume centers in India is comparable to that you would find in any of the best institutions anywhere across the country. In a gastric cancer that has not spread to any other parts of the body, surgery and chemotherapy are probably the only treatment modalities that are available, although there are studies going on to look at the benefit of adding radiation before surgery. Now, in a patient in whom the gastric cancer has already spread to other parts of the body, there are a whole lot of newer treatment modalities, newer drugs that are available, which are of course very expensive and thereby making it out of reach of a vast majority of our population. So this is where I would say that the accessibility of our population to these kind of treatment is quite less. Yes, offhand I can tell you about clinical trial that is happening across many institutions in India. Almost 30 institutions are taking part in this trial. It is called the NAGA trial. Here we are looking at comparing chemotherapy that is given before surgery or chemotherapy that is given after surgery to determine which is a better mode of treatment for patients with gastric cancers that can be operated. There are some other trials in metastatic disease that is happening, trials using a form of treatment called intraperitoneal chemotherapy, where the chemotherapy is directly delivered inside the abdominal cavity in different forms, either as just as a heated liquid form or as a pressurized aerosol form, which is called PIPAC and HIPEC. So these are some of the studies that are looking at trying to improve the cure rates of these patients who have very advanced gastric cancers. I think it is a very good initiative trying to bring together oncologists from all the parts of India and also from international delegates also, as well as faculty. The quality of deliberations and the choice of scientific topics are really very good, and I wish this effort would continue. This would enhance the knowledge of all the oncologists in the country as far as the newer treatment modalities of cancer are concerned.